أنا اسمي تبارك جبار وسيميناري عن الماكسيلاري sinus disease and the relation to oral surgery. كintroduction راح أشرحها أني والتكملة تشرحها زميلتي تبارك حسين. Maxillary sinus. The maxillary sinus is a dominant bilateral anatomical structure in the posterior maxilla and the midface. It is larger than the other sinuses and it is referred to as the intrum of the hymo because intrum meaning a cavity or hollow space especially found in bone. This is an illustration of the inverted pyramidal shape and the location of the maxillary sinus, which is lodged inside the body of the maxilla. The maxillary sinus is part of a series of paranasal sinuses which include the frontal sinus, the ethmoid sinus, and the sphenoid sinus. In this picture we can see the paranasal sinuses, the frontal sinus above the eye, the ethmoid sinus between the eye and the sphenoid sinus behind the eye. The boundaries of maxillary sinus rough is the floor of the orbit and the floor alveolar process of the maxilla. The interior wall is the interior surface of the maxilla. The posterior هو infratemporal fossa and the pterygopalatine fossa. Here also we can see the boundaries of the maxillary sinus. The relationship of the maxillary sinus related above to the orbit, related below to the roots of the upper molar and premolar teeth, related behind to the infratemporal fossa, related medially to the lower part of the nasal cavity, as we can see in the picture. الماكسيلاري sinus blood supply. The blood supply maxillary sinus is supplied by branches of the internal maxillary artery which include the infraorbital, the alveolar, the greater palatine and the sphenopalatine artery, and you can see them in the picture. The maxillary nerve supply it is inverted by branch of the second division of trigeminal nerve V2 maxillary branch, which include the middle superior alveolar nerve, the interior superior alveolar nerve, and the posterior superior alveolar nerve, also the infraorbital nerve and the greater palatine nerve. Here we can see also the nerve supply of the maxillary sinus. The clinical examination include first inspection. Middle third of the face should be inspected for the presence of asymmetry, deformity, swelling, erythemia, ecchymosis. Second, palpation include the palpation of the facial wall of the sinus above the premolar where the bone is thinnest. Third, the transillumination test. It is performed in a dark room by inserting an electrically safe light into the mouth with the lid closed. Good transillumination indicates the presence of air in the sinus, while the failure of transillumination indicates the presence of pus, fluid, solid lesion. Here in this picture we can see transillumination of the maxillary sinus with a fibro-optic light source. The left maxillary sinus is normal and transilluminated by the fibro-optic light source in the palate. The right maxillary sinus is filled with fluid or pus from infection and has decreased transillumination. A radiograph of the maxillary sinus. The X-ray film that best view of paranasal sinuses is the water view اللي هي occipital view, which demonstrate the paranasal sinus and the fluid level in sinus. We also have the OBG, CT scan film, MRI, compound CT اللي هي CBCT. First, periapical radiograph. The border of the maxillary sinus appear as a thin, delicate radio-opaque line. In the absence of disease, it appears continuous, but on close examination, it has small interpretation in its smoothness or density. The roots of the maxillary molar usually lie in close opposition to the maxillary sinus and may project into the floor of the sinus, causing small elevation or prominences. Second, we have a panoramic radiograph provide an extensive overview of the sinus floor and its relation with the tooth roots. Here we can see a panoramic radiograph showing a mucus retention phenomena on the floor of the right maxillary sinus. We also have a water view radiograph here demonstrating the right maxillary sinus with an air-filled level. We also have a CT scan and the MRI. These modalities provide multiple sections through the sinus at different plans and therefore contribute to the final diagnosis and the determination of the extent of the disease. Finally, we have axial CBCT. الديزيز أو الكومبليكيشن affecting الماxillary sinus. First we have sinusitis, الأورا intral fistula أو displacement of root أو tooth into the maxillary sinus, the fracture of maxillary tuberosity and the malignancy of maxillary sinus. Sinusitis is the inflammation of the mucosa of any of the paranasal sinuses. The causes of sinus inflammation include viruses, bacteria, fungi, allergies, and an autoimmune reaction. The maxillary sinusitis can be classified into acute and chronic. The acute maxillary sinusitis may be suppurative or non-suppurative inflammation of the intral mucosa. It lasts less than 2 weeks and respond to antibiotic therapy. There may be nasal blocking following rhinitis, thick mucopurulent, foul smelling, discolored nasal discharge may follow. It is characterized by facial pain localized to the cheek, but also in the frontal area of the teeth. The pain can be unilateral or bilateral, and tenderness may overlay the sinus. Here in this picture we can see a healthy sinuses and also we can see acute sinusitis. We can see an inflammation and mucus albus in the sinus. Also here we can see a healthy and inflamed sinus. We have subacute maxillary sinusitis, may be intermediate stage between acute and chronic. The relief may come slowly or suddenly, but it is take place soon after the improvement of drainage from the sinus reach the point that the secretion are able to leave the cavity as they form. Finally, we have chronic maxillary sinusitis, may be due to a persistent dental focus, chronic rhinitis, chronic infection in the frontal or ethmoidal sinuses, allergic condition. It lasts longer than 2 weeks or require longer course of medical therapy and may require surgery. The condition sometimes is asymptomatic. Pain and tenderness in the area of intrum is found. Unilateral foul discharge through the posterior nares. Cacoxemia, fetid odor with bad taste in the mouth. Here an X-ray. Here is a difference also between a healthy sinus and sinusitis with the symptoms which is nasal mucus, plugged nose, facial pain, fever, headache. The treatment, if it is allergic condition, it's treated by antihistamine or steroid. Bacterial sinusitis treated by antibiotic, surgical treatment, enterostomy when it is needed. Second, we have an oral intral fistula. An oral intral fistula is an epithelialized pathological unnatural communication between these two cavities. A small oral intral up to 5 mm wide may heal spontaneously, but a larger orointral fistula would require surgical closure to prevent the development of persistent orointral fistula and chronic sinusitis. Orointral fistula can result from several causes: extraction of teeth, destruction of the portion of the floor of the sinus by periapical lesion, perforation of the floor of the sinus, and chronic infection of the maxillary sinus such as osteomyelitis. Here in this picture we can see orointral fistula, which is an abnormal epithelialized communication between the maxillary sinus and the oral cavity through perforation in the sinus wall. Thank you.